Hi, good morning.
Good morning.
My name is Gloria Trivino. I'm going to be the nurse practitioner for today.
Okay.
Can I see your Arben?
Yes.
What is your name?
Christine Guerra,
Okay, and your date of birth?
9/18/88.
Perfect. Okay, Miss Guerra, let me provide some privacy for you, and then I'm going to start doing a head-to-toe assessment. I'm going to explain you everything by the process. I understand that you came here for your annual exam. Then now we're going to start by your skin. Your skin color is congruent with your ethnicity, is pink. I don't see any cyanosis or erythema. Your skin feels smooth, warm, and moist to touch. There is no lesions and no rash. Let me just do a tinting test. I see instant recall of the skin. Then I was telling you that I don't see any scars, birth marks, rashes, or freckles. Now I'm moving to check your nails, which they appear very uniform in color and consistency. They feel smooth to touch, free of lesions, clogging, and pitting. Let me do a clogging test. Could you please put your fingers like that? I don't see any clogging. Your nails appear in really good condition. And then now let me just do your capillary fill, which is less than 2 seconds. Then now I'm moving to your head. I'm going to start assessing your hair. His is very soft and fine, uniform in color, even distribution of hair through the head. There is no signs of patterns or hair loss. The scalp feels smooth and has an even coloration. I don't see any lesions, scaliness, bruisiness, dandruff, or any foreign bodies noticed on a scalp. Your head looks morphocephalic. Your skull is round, no lesions or deformities. I don't feel any lumps or depressions. Then now I'm going to see your face. You look very pleasant and relaxed. I don't see any involuntary movements. Your face is symmetrical and no superficial masses or edema noted. Now I'm going to check for the central nerve number 5. Then I'm going to start with the sensory. Then I'm going to touch your face and you're going to let me know if you feel something. I'm checking at this moment for the ophthalmic branch, maxillary branch, and the mandibular branch, which she said that she feels me when I touch her. Now I'm going to touch to do the motor. Could you please clench your teeth? Okay. I feel equal battlary strength. Now I'm going to check for your corneal reflex. Then I'm going to use the tip of the cotton. Could you please look upward? Okay, I'm touching. She's blinking, which is normal. The same thing with this eye. She blinks, is normal. Okay, now we're going to check for the cranial nerve number 7, which is the facial. I'm going to ask you to raise your eyebrows. I see that. Okay, now I'm going to ask you to smile. Perfect. Now I'm going to ask you to puff your cheeks. Okay, now show me your teeth. Perfect. Now I'm going to palpate for the frontal and maxillary sinuses. Please let me know if you had any pain. I'm touching the frontals, which she denies pain. Now I'm touching the maxillary, no pain. Okay, Miss Guerra. Now we're going to do the visual acuity. I had behind me this learning chart is about 20 feet. Then I'm going to ask you to cover one of your eyes and read the letters.
DEFP.
Okay. Then now let's do the other eye.
DEFP.
Okay. Now with both eyes.
DEFP.
Okay. It's perfect. Now we're going to do something is called confrontation. Then I'm going to be moving my fingers. Then you're going to let me know when you see them. Okay? Do you see them?
Yes.
Do you see them?
Yes.
Do you see my fingers?
Yes.
Do you see my fingers?
Yes.
Okay, perfect. You're doing great. Then now I'm looking at your eyebrows. They are symmetrically with even hair distribution. Your eyelashes are even and curved outward. And I don't see any lesions in your eyelids. Let me just look at your lacrimal ducts. No swelling or discharge. At the same time, I'm looking for your conjunctiva, no nodules or lesions or swelling, and I didn't see any jaundice or erythema. Also, in your eyelids, I don't see lesions or edema or drooping of the eyelid. Then now I'm going to do cornea. I'm going to check your cornea. I'm going to use the pen light. Then you're going to be bright light. I'm going just to checking for your lenses. I see transparent and no opacities and no shadows. The same, let me see in this eye. Yes, I don't see any shadows or opacities. It's transparent. I'm going to check now for your pupils. They are round, equal inside, about 3 millimeters. Then now I'm going to do a pupil direct conceptual light reaction. That's I'm going to be putting light in your one of your eyes. Then it's going to be constrict with constriction in the opposite eye. That is react to light and accommodation. Then I see that you're reacting and you're having conceptual constriction in the opposite eye. The same thing on this one. I see the conceptual constriction in the opposite eye. Okay, Christine. Now I'm going to do the cranial nerve number 3, 4, and 6. Then I'm going to ask you to follow my finger.
Okay.
Okay. And then now I'm going to do a convergence. Okay. Yes. Then your eye follow. That's okay. Now I'm going to use the ophthalmoscope to check your for red reflex, to check your lights, to your eyes inside. Then let me check. Perfect. Let me check the other one. Perfect. Then I see the your octidisc is is sorry. Okay, I see your octidisc is physiologic cup 2 to 1. There is no swelling or papilloma noted. There is no lesions noted in the retina. Arteries are smaller and brighter than veins, with no crossing noted. Okay? Then for now, I'm going to check your ears. Then let me see. Your ears are symmetric, equal in size, and they are in the line of the eyes. I'm going to do a test, and you're going to tell me if you feel any pain. It's called talk test. Do you feel any pain?
No.
Do you feel any pain?
No.
Okay. Now I'm going to look inside of your ears. And let me just get ready. Okay. Then can you look over there? Okay. I'm checking inside. Perfect. Now I will check to the other side. Perfect. Okay. I don't see any discharge, no any foreign bodies, no swelling or cerumen in your ear canal. Your tympanic is intact, pinkish gray, and I was able to visualize the corner light and the malleus. Okay. Then now I'm going to do the central nervous, the CNA number 8, that is the auditory for your ears. Then I'm just going to do something is called the whisper test. Then I'm going to ask you to cover the opposite side. I'm going to whisper something on this side. 1, 2, 3.
1, 2, 3.
Perfect. Can you do it on the other side? 1, 2, 3.
1, 2, 3.
Okay, perfect. Perfect. There is no damage in your ears. Then I'm going to do something that's called the Weber test. Then
Okay.
you're going to tell me is you hear something.
Yes, I hear.
Okay, bilateral?
Yes, on both ears.
Okay, perfect. Then now we're going to the rhyme test. I'm going to put it in the bone behind your ear, and you're going to tell me when you stop hearing it.
Okay, it stops.
Okay, now in the front.
Okay, it stopped.
Okay, now I'm going to do it to the other side.
Okay, it stopped.
Okay, what about here?
Okay, it stopped.
Okay, okay, it's perfect. Then now that you're here, then I'm going to ask you to, I'm going to check your nose. This
Okay.
is the part of the nose. Then your nose is midline. There is no swelling, no deformities noticed. Can you just close one side and take a deep breath? Do the same thing to the other one. Okay, perfect. Then I'm going to check your nasal canals. Then let me just use this. Could you please flip up? Okay, now to the other side. Okay, then your nasal mucosa is pink and moist. There is no sign of swelling or bleeding. Your nasal septum is midline without perforations or deviations. There is no inflammation or polyps notice. I can see the inferior turbines. They are elongated, tubular, the size of the index finger of one adult. And the middle turbines are about the size and shape of the pinky finger. The superior turbines are not able to be visible. The cranial nerve number 1 is olfactory. Then now I'm going to ask you to close your eyes and close one of your nostrils and let me know if you can smell.
Yes.
Okay, let's do the same thing with the other side. Do you smell anything?
No.
Okay, what about now?
Yes.
Okay, perfect. Okay, then and just now I'm going to check for your mouth and pharynx. Your lips are moist. I don't see any lumps or cracking. Can I see your mouth? Open your mouth. Okay, perfect. Your oral mucosa and close. Can I see your gums? Okay, perfect. Your oral mucosa and gums are pink, moist. I don't see any ulcers or nodules or white patches. Um, your tongue is pink, smooth, and moist. And also, I didn't see any lesions. And also, I can see that your teeth are white, intact, and I didn't see any loose tooth or missing any loose or missing tooth. Then the top of your mouth is intact without any lesions. And I was able also to visualize your tonsils, which are pink and small, and there is no any exudation noted. Then you're okay. Now I'm going to ask you to stick your tongue out and just move it to the side. Okay, perfect. That one is the cranial nerve number 12. Now I'm going to check for the um, cranial nerve number 9, sorry. Then could you please open your mouth and say ah?
Ah.
Perfect, perfect. Then the palate rises symmetrical and the uvula is midline. Then for the cranial nervous number
10, which is the vagus, is the gut reflex. We use a tongue depressor, but I'm not going to do it at this time. Okay, we put the tongue depressor in your tongue and we're able to get the gut reflex. Now let me just palpate you submandibular and sublingual gland. Okay, I don't feel any swelling, any nodules. It looks very normal. There is no problem. Now let me continue with your neck. Then this, which is the cranial nerve number 11. Then I'm going to ask you to, I'm going to put my hand in your cheek and I'm going to ask you just to um, go to this side. Okay. Do the same thing in this one. Okay. I'm going to put my hands in your shoulders and I'm going to ask you to shrug your shoulders. Okay, perfect. I was checking for the trapezius and the sternomastoideo muscle, but they're working okay. Can you swallow? At this moment, I'm checking that the thyroid gland. Let me just check. Swallow again. Yes, I can feel it. Then now I'm going to displace your trachea a little bit to the other side. Then I'm going to palpate the laterally in both sides. Let me just do the other side. Okay. Then the side is consistent, is normal. I didn't feel any nodules or tenderness. Also, I don't see any size of goiter. And your thyroid gland appears uniform and symmetric. Then at this moment, I'm going to palpate your carotid one at a time for trios. Okay. I don't feel any trios. Okay, perfect. Then I'm going to auscultate with my diaphragm to see if I can hear any breaths. No, no, perfect. Okay, now I'm going to palpate your lymph nodes. Then we're going to start with the pre-auricular. Do you feel any pain? No.
No.
Okay. Post-auricular, occipital, tonsillar, submandibular, segmental, superficial cervical, posterior cervical, and supraclavicular. Okay, there is another part, is right here in your arm. It's called the epitrochlear. There is none and there is none. Okay, everything is okay for now. Okay, Christine, now I'm going to check your chest, your anterior chest. I'm going to ask you just to drop your gown a little bit. Then, okay, I don't see any lesions on the chest. There is no on labor respirations. You're not using your accessory muscles. You had a regular rhythm. Let me just check your respirations. They are about 16 respiration per minute. Your anterior posterior to lateral diameter is 1 to 2, meaning that the lateral diameter is bigger than the anterior posterior. Then I don't see any chest deformities. Then let me just check for tenderness. Do you have any tenderness?
Mm-hmm.
Okay. And also I don't feel any fremitus. Okay, let me just put your gown up and could you please turn? I'm going to check your posterior checks. Then I don't see any skin lesions or scars. Your spine has a normal curvature and cervical and lumbar had concave curve. Thoracic and sacral regions are convex. Then there is no spinal tenderness. Then let me check for tactile fremitus. Can you say 99 when I'm touching you?
99, 99, 99, 99.
Okay, perfect. Now I'm going to auscultate your breath sounds. Then I'm going to do it in a ladder pattern. Then could you please take a deep breath when I'm doing this, please? Okay, 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 okay. Vesicular, vesicular sounds are noted throughout. Okay. And now I'm going to ask you to lie down on the bed again. Then I'm going to ask you again to uncover your chest. Then I don't feel any trail or hips around, okay? And also I don't see any lips. Then I'm going to check for the point on maximal impulse, which is on the left intercostal space, mid-clavicular line. It's about 1 centimeter of diameter. Perfect, it's just right there. Then now I'm going to auscultate your um, your heart. Then I'm going to start in the second intercostal space, right external border, which is your aortic bone. Then in the second intercostal space, left external border is your pulmonary bone. And now in the fourth intercostal space, left external border is your tricuspid bone. And in the fifth intercostal mid-clavicular line, we can find the mitral bone. Okay. And now let me cover your chest and I'm going to inspect your abdomen. Okay. Your abdomen is symmetric. I don't see any bulges, no visible peristalsis or pulsations, no scars, no strias or dilated veins, and no rashes or lesions. Okay, I'm going to auscultate for vowel sounds, starting for the right lower quadrant. I will take 5 minutes doing this in each quadrant. Okay, okay, there is present, vowel sounds present in all four quadrants. Now I'm going to check the aortic, arteries, and the iliac, pardon, I'm sorry, the renal ones. These are the renal, iliac, iliac, and femoral. Okay, no bruise present. Okay, now I'm going to percuss your abdomen. I just heard tympani. Okay, now I'm going to check for your spleen, which is in the mid line, mid axillary line on the sixth rib. I'm going to start percussing right here. Okay. I only heard tympani sounds. That means that you don't have an inflamed um, spleen. Okay, then, okay, yeah. Then now I'm going to check for the liver. Then I'm going to start in the about the umbilicus in the mid clavicular line, going upwards. doing the percussion. Then I will mark when I feel dull. Then now from the second one, the second intercostal line, I will going down, percussing. Then I will make a mark when I feel dull. Then it's about right here. Then your liver has a normal size. It's like between 6 to 8 centimeters. Then now I'm going to palpate the border or your liver. Could you please make a deep breath? Okay, that's okay. I feel the border is smooth, sharp, and regular. Okay, now I'm going to use light palpation in your abdomen, looking for any masses or tenderness. Do you feel any tenderness?
No.
Okay, okay. Then I'm going to palpate bilaterally on the groin to see if you had any bulges or hernias present. I don't see any. And let me check on in your pre-umbilical area. No, I don't feel anything. Do you feel anything? No. Okay. Now I'm going to do a deep palpation using my two hands on the four quadrants. Okay. There is no masses. I don't feel anything. And do you have any pain?
No.
Okay. Then I'm going to check for appendicitis. There is some tests that we have to do for appendicitis. I'm going to press here, and when I let, it's called MAC burnings. And you're going to let me know is when I let go, you feel pain.
Okay.
Okay. Then now I'm going to do the rope sign. Do you have any pain?
No.
Okay. If you had pain, it will be like refer pain to the right, from the left quadrant to the right quadrant. That will be a positive sign for appendicitis. Then I'm going to do the psoas sign. Could you please lift your right leg? Then I'm going to push. Okay, pain?
No.
Okay, then not. It's okay. Then the other test is the obturator. Then I'm going to rotate your right hip internal and externally. Okay, going here and here. Any pain?
No.
Okay, perfect. Okay, then I'm going to check your legs. Let me cover you for now. We're almost done. Christy, I know this is a long day for you. And then checking your legs, then I don't see any lesions, scars, or ulcers. Your color is adequate to your ethnicity. There is warm on temperature and is a uniform hair distribution. I don't see any varicose veins in your legs, and also there is no edema. I don't see any edema. Okay. Now I'm going to check for your pulses. This is the radial pulses. I'm going to do it bilaterally. This is your brachial, femoral, popliteal, dorsalis, pedis, and posterior tibialis. Then again, pedal dorsis, posterior tibialis. This is your popliteal. Okay. The femoral. Can I have your hand? And this is your radial. And right here, I got your brachial. Perfect. That is +2. Okay, Christine, I'm going to ask you to sit down on the board or the bed. I'm going to check for your muscle strength. Then I'm going to do the elbow flexor. Could you please put your arms like this? Okay, don't let me, okay, just against mine. Okay, perfect. Now let me check your knee extensor, the same thing. Okay, just lift and don't let me push. Okay, don't let me push. Perfect. Let me just do this one again. Don't let me push. Perfect. Okay. Then all gray, they are 5. Just the number 5. Okay, now that you're sitting right here, I want to ask you just to do the same thing that I'm going to do. Okay, that's the run. Perfect. Then now I had another test. Then I want you to touch your nose and touch my finger. Touch your nose and touch my finger. Now you can use your other arm and do the same thing. Touch my finger, touch your nose. Okay. Okay. Then now you can get up from the bed. Let me help you. Okay. I just want you to walk a couple, just go to like a 20 feet and just looking for your strength. I don't see any lifting. Everything is perfect. Okay. Then um, now that you're here, can you just please stand right here close to the bed? And I'm going to ask you to close your eyes and put your hand in your against your body and just close your eyes and stay there. Then I'm looking that you're not swagging or losing your balance. That's perfect. Now that you're here, with your eyes closed, could you please lift your arms with your palms, yeah, up. Then, okay, I'm going just to press, don't let it go, just against me. Okay, now stay right there like for 20 seconds. Okay, I don't see any drip. Everything is okay. Okay, you can open your eyes. Then now I'm going to do to touch you. Then let me know if you feel. Close your eyes when I'm touching you. You need to tell me where.
My left upper arm,
Okay,
my right arm, my left leg, my right leg.
okay, perfect. Okay, let me see. I'm going to do another test. Let me just get something from my hand, from my pocket. Then you're going to tell me what I'm putting in your hand. Okay, let me see. And tell me what it is.
Rock,
Yes. Let me put it on the other side.
a rock,
Yeah. Okay. Then now I'm going to do something in your palm, and you're going to tell me what I'm writing on. What is what I'm writing?
an 8,
Yes. Let me check with this one.
a 5,
Yes, perfect. That's called the one when you describe what I put in your hands is a sternoxis, and the one what I write is called graphesthesia. Okay. And before you sit down, I forgot to ask you when you walk, I want you to walk with your heel to toes. Okay. Okay. And now I want you to use your heels. You're doing great. Okay. Okay. And the last with the walking, your tiptoes. Okay. Okay. We can do this test standing up. Okay. Then I'm going to check for your um,
Okay, Chris, let me get the hammer. Then I'm going to start checking your reflexes. Then I'm going to start by the bixes C5 and C6. Then I'm going to ask you to put your arm over my arm. Then I will put my thumb in your brachial area. Then I will be hitting the with the arm with the hammer on my thumb. Then I will see flexion at your elbow, and also I'm going watching for feeling contraction at your biceps muscle. I will do the same thing with the next arm. Same position, I will put my thumb in your brachial area, then I will hit it with the hammer, then I will see the flexion of the elbow, and I will feel in the contraction of the biceps muscle. Now we're going to do the brachioradialis, which is C5 and C6. It's about 1 or 2 inches above the ribs, and I'm looking for flexion and supination of your forearm. Then now I'm going to do the triceps. The triceps is C6 and C7. I will just put your elbow over my arm. Then I will be hitting the tendon. Then I will be seeing the contraction of the biceps muscle and extension at the elbow. I did it in both arms and they are positive. Your reflexes are graded 2. They are average normal. Then now I'm going to ask you to sit down. I'm going to be checking your knees. Then I'm going to be tapping on your knees about the patella. Then could you please sit down? Okay. Then I'm going to be hitting about the patellar tendon just below the patella. Then I'm going to see the extension of your knee when I'm hitting. The same thing, I will be seeing the extension of your knee, which is also a positive reflex. You are 2+. Now I'm going to ask you to stand up. Could you please stand up? And kneeling on the chair, I'm going to check for your ankle, which is primarily S1. I'm going to be tapping the Achilles tendon. Then I will see your dorsiflex of the foot. Now I'm going to do the Babinski, which is L5 and S1. Then there is no curve medially across the ball of the foot. Then I don't notice any movement in your big toe, which is a normal plantar flexion. I just wanted to tell you that when you were standing up, we were doing the Romberg test. And also, when I asked you to lift your arms, you were doing the pronator drift, which they were normal. Now, everything is okay. Then I see you in about a year. Okay, Papi.